Do you frequently feel like your heart pains sometimes? Or do you feel extremely upset when a loved one, like your mom, dad, or partner, has to leave, even for a short time? Maybe your hands sweat, you can't stop thinking something bad will happen, or you can't focus at work or school. If this sounds familiar, you might be experiencing more than just missing someone. It could be a mental health condition called separation anxiety disorder. Most people think only kids get anxious about being away from parents, but adults can struggle with it too. Imagine dropping your child at school and feeling like you're going to cry the whole drive back, or calling your spouse 10 times in an hour when they're just at the grocery store. That's not just caring, it's anxiety taking over. This disorder makes normal separations feel like emotional emergencies. So what causes separation anxiety disorder? Think of your brain as a security alarm system. In some people, this alarm is too sensitive. A small trigger, like a text message, that isn't replied to can set off a full panic. Some people are born with brains more likely to react this way. Family history matters. Did your parent often worry about you getting hurt? That behavior can be learned. Life events also play a role. For example, a child who survived a natural disaster might start fearing their parents won't come back. Or an adult whose partner suddenly got very sick may develop intense fear of being apart. Even moving to a new city or changing schools can spark it. It's often a mix of sensitive personality tough experiences and maybe even genes. It's like having a wet match, easy to light, hard to fully put out. Imagine a 7-year-old who refuses to go to a birthday party unless their mom is there and throws a tantrum when asked to try. Or an adult who can't sleep unless their partner is home and calls every 15 minutes if they're not. People might have stomach pains, headaches, or shaking when separation happens or is expected. Kids might beg to skip school fearing something will happen to their parents if they're away. Adults might avoid travel for work or stay home from events. They often imagine disasters: dad's going to get in a car crash, or my kid will be kidnapped. Nightmares about separation are common. It's more than missing someone, it's constant fear that can't be calmed easily. How do doctors know it's separation anxiety disorder and not just normal worry? They talk to the person or their parents and ask about feelings, thoughts, and behaviors. For a diagnosis, the fear has to last at least 4 weeks in kids and 6 months in adults, and it must cause serious problems in school, work, or relationships. It's not just about being sad, it's about daily life being disrupted. Treatment often includes talk therapy, especially a method called CBT, cognitive behavioral therapy. Imagine a ladder. You start small, like staying in your room while your partner is just in the kitchen, and slowly go higher, like staying alone for 30 minutes. You learn to breathe slowly, challenge scary thoughts. What's the real chance dad will crash, and reward bravery? For some, medicine like antidepressants can help calm the brain's fear system. The goal isn't to stop loving or caring, but to love without fear. Can you prevent separation anxiety disorder? While not everything can be avoided, early habits help. Think of it like training a muscle. For kids, short playdates or sleepovers build tolerance to being apart. Parents can say, "I'll be back after story time." Practice makes it easier. For adults, it's about facing fear gently. Try leaving your phone in another room for 10 minutes. Or let your partner run a quick errand alone. Support and consistent routines are key. Don't avoid things, face them gently. In schools, programs that teach kids coping skills can make a big difference. Prevention is like carrying an umbrella before it rains, not a guarantee, but it helps. Scientists are learning more every. Recent studies show that brain scans of people with this disorder often show overactivity in areas linked to fear and danger detection. New therapy apps now guide users through calming exercises during separation moments. Some researchers are testing exposure therapy with virtual reality, like simulating a child going to school while the parent is away, in a safe space. Also, studies suggest that treating anxiety early, even in preschoolers, can prevent it from growing. One 2023 study found that family-based CBT reduced symptoms in 70% of kids after 12 weeks. Progress is happening and hope is growing,